Over the last week, we have averaged 239 deaths per day, an increase of nearly 48% over the prior week. Each death is tragic and even more heartbreaking when we know that the majority of these deaths could be prevented with a simple, safe, available vaccine.
With hospitalizations and deaths on the rise, the CDC director says the highly contagious Delta variant now accounts for 83% of new COVID cases. Have we entered a fourth wave in the pandemic? Welcome back to Morning Joe. It is Wednesday, July 21st. Joe has the morning off. Along with Willie and me, we still have the AP's Jonathan Lemire, and MSNBC contributor Mike Barnicle joins us as well. Let's begin right there with the dangerous Delta variant. As we said, now responsible for most new COVID infections. A full 7 months after the first highly effective vaccine became available in this country, hospitals are again inundated with a surge of very sick patients. And the number of cases is climbing across the country. And now more elected officials are working to get people vaccinated. Last hour, we mentioned Congressman Steve Scalise of Louisiana. At first in April and in May, when he was asked if he was getting the vaccine, he said soon, soon. He finally got his first shot this past Sunday and publicized it, saying, quote, when you talk to people who run hospitals in New Orleans or other states, 90% of people in the hospital with Delta variant have not been vaccinated. That's another signal the vaccine works. The House Minority Whip added that the vaccine is safe and effective. Willie.
Meanwhile, Senate Minority Leader Mitch McConnell again is encouraging Americans to get vaccinated as the United States sees that surge in COVID cases. McConnell has been one of the most outspoken members of his party, urging vaccination to stop the spread of COVID.
These shots need to get in everybody's arm as rapidly as possible, or we're going to be back in a situation in the fall that we don't yearn for, that we went through last year.
Meanwhile, more than 200 Missouri pastors are teaming up to promote vaccination. The Christian faith leaders will launch an advertising campaign and issue a plea for Missourians to get vaccinated, quote, as a way of following Jesus' command to love your neighbor as yourself. The idea was spearheaded by a Christian magazine in the state of Missouri. Let's bring in director of the Center for Infectious Disease Research and Policy and a professor in the medical school at the University of Minnesota, Dr. Michael Osterholm. Dr. Osterholm, it's good to see you this morning. We'll get into the particulars of where we are in this country right now, but I'm curious what you think about the importance of these kind of what's being, trusted partners, as they're called, inside these communities, inside Christian communities. Someone as prominent as Mitch McConnell or Steve Scalise, who's been hedging about whether or not he thinks people should get vaccinated, not just getting vaccinated, but posting a photograph of himself getting vaccinated, perhaps a statement of how serious things are getting across the country.
Well, let me just put one number out to begin the discussion with, which I think should be our focus. 100 million. There are 100 million Americans right now who are not vaccinated or who have not had COVID yet and developed their own immunity. Some of these are obviously kids that can't be vaccinated yet, but it gives you an idea just how many people left for this virus to infect. So we need all the help we can get. Right now, we really have three different groups of people in this country with regard to vaccine. The vaccine affirmative, people like myself who couldn't wait to get the vaccine. Then we have the vaccine hesitant, people who really are thinking about it, they want to get it, but they still have concerns about its safety. And then there's the vaccine hostile. I'm not sure we're going to change that vaccine hostile, but I think there are a lot of vaccine hesitant people right now that we could move. And the leadership of the Republican Party, of certain kind of media venues that can help come forward, we can only do nothing but help us with that vaccine hesitant group.
Dr. Osterholm, you've always been incredibly straight and blunt with us over the last year and a half as we've walked through this pandemic together. So in your estimation, where are we right now?
Well, we clearly are in an area of uncertainty, but I would like to, I think, add a context to a lot of the comments. People are worried about, we got to get vaccinated now for the fall. You know, I don't know that the fall is going to be it. I think it could be right now. For the first time in the pandemic, we're seeing cases increase substantially in all 50 states. Surely less in the Midwest and the upper Northeast, but we're actually seeing right now 42 states that have had over 100% increase in cases in the last 2 weeks. This variant is a bad, bad virus. It's 1,000 times more virus produced when someone who's infected. It clearly is much more infectious than the previous strains, and it's a virus that will find you if you're not vaccinated. Well, we have to tell people you can't, wait out the clock on this one. This is not one that, one day I can say, well, I avoided it. This virus will eventually find you. You have a choice. Either get vaccinated and be largely protected, or not get vaccinated and run the risk of being hospitalized in intensive care or even dying. And even last but not least, because we can't vaccinate our kids right now, you want to bubble those kids as much as you can. Don't bring the virus home and infect one of your kids. I actually know of personal experiences where adults have brought the viruses home, their kids have gotten infected, and they become seriously ill. You don't want that to happen. Get vaccinated.
Dr. Osterholm, Mike Barnacle has a question for you. Mike?
So, Doctor, we are now, as you just artfully described, dealing with the Delta variant. The globe is dealing with the Delta variant. My question to you might be unanswerable, but are these variants going to exist for years and years? Are we going to be dealing with potential vaccinations for these variants 4 or 5 years from now?
This virus is here to stay, Mike. It's not going to go away. Our job is to control it the best we can. And, I know that people are concerned about variant development here in the United States among the unvaccinated, but let's just put that into context. There are 6.4 billion people that live in low and middle income countries that have virtually no access to the vaccine at all. Right now, we are seeing this virus ravage around the world. And every time that we see one of these horrible situations, obviously we think about the number of people ill and dying. I also think about the number of new variants that are spinning out of that very situation. So you're right. Delta is the worst we've seen so far, but it hardly means that it's the last one we're going to see. So I think that this is our challenge, and why with the vaccines, as many people as we can get vaccinated, we not only obviously prevent illness and in hospitalizations and deaths, but we prevent the possibility of new variants developing. So this is why we need a Manhattan Project in getting vaccine to the rest of the world, and we need a Marshall Plan to deliver it.
Hey, Doctor, it's Jonathan Lemire. Good morning. I just want to go back to something you just said about bubbling the children of the country, and that's a striking phrase. And I wanted to ask you two things about it. First, what can you tell us right now about the impact of the Delta variant? Like, are kids getting sicker with this particular variant than earlier strains of coronavirus, where it seemed like, with exceptions, children were largely unaffected? But then secondly, and importantly, are you recommending that this fall, as parents across the country are gearing up for the start of the school year again, that children should not be going back to school for in-person learning, even if they are, say, wearing masks and windows are open and other mitigation factors?
Well, first of all, the epidemiology of this virus in kids, in other words, the way that it's transmitted, who gets infected, how many people get infected, has really changed from the beginning of the pandemic. If we were sitting here having this conversation a year ago today, we would have said kids very rarely get infected, or if they do, they only rarely really get sick, and they almost never spread it to anyone else. When the Alpha variant emerged, that B117, last December and January in the United States, that began to change the situation in kids, and Delta has completely changed it. We are seeing widespread transmission to and by kids. And so many of the recommendations, even the CDC recommendation on school openings, are outdated and somewhat not helpful, because we now know that the Delta variant can, in fact, cause more illness in kids. Look at the number of reported outbreaks in summer camps that are occurring right now with this in kids. So I think this is something we surely have to take real concern about in terms of what it means for kids. Now, kids are still getting infected at a rate that's higher than last year, but we're not seeing large numbers of ill kids, meaning that that in the sense the rate of serious disease is still relatively low per 100 people getting infected as a child. But I think it's fair to say that at this point we need to think about the fall. What is this going to mean? What's going to happen with the rest of the summer? We may see a major surge of cases this summer that could surely change how many people are infected and now recovered before school starts. But I think that kids are back on the table as an unknown in terms of this pandemic.
What's the risk at this point, Dr. Osterholm, in your eyes, of us sort of sliding back to where we were, I don't know, 6 months ago before the CDC issued its guidance saying, okay, it's safe to take off the mask now, certainly outdoors. We've seen Los Angeles County, which was doing well, put its mask mandate back in for indoor settings. Do you think we're at risk of seeing that nationally?
Well, I think one of the things, Willie, that's really important is we can't be lulled into a false sense of security. I can tell you, much of the last 3 months, very few people in the media wanted to deal with a bad news story about this and what was happening with Delta in other parts of the world and what it would mean when it came here. It was all about a celebration. You know, when 4th of July, we celebrated, you know, basically getting past COVID. I think people are now realizing that was premature consideration. And that even to the extent that some of the scientific experts on the media have been saying, well, this is going to be a seasonal disease, fall and winter. It's going to skip the summer. Well, look what it's doing right now. It's not skipping the summer. This virus is going to do what it's going to do. So I think on one hand, we have made major inroads with the level of vaccination we have in the United States. But again, I put that 100 million number out in front and say we still have a long ways to go. And so I think that the challenge is, you know, we can't let this virus freeze us into inaction and a lack of everyday life. At the same time, we have to understand it's not going to go away soon. And if you're in places right now, such as in the South, you actually are seeing the worst days of the pandemic to date. And I think by the time the summer's over with, we're going to see other parts of the country where this is going to happen too.
Dr. Michael Osterholm, thank you so much for being on this morning. We hope to see you again soon.